I will invite Dr. Farooqui, and he will talk about artificial intelligence in teleophthalmology in cataract surgery. And then we'll go back to ROP, and then we'll carry it on from there. Thank you.
Good afternoon, thank you, Dr. Bali. It was a wonderful talk. You dealt into, I think, a lot of technicalities. I'll try to make this topic of teleophthalmology and artificial intelligence in cataract with Indian perspective as simplified as possible. So I'll be discussing this topic. Now, in recent years, the artificial intelligence has had profound and increased impact in ophthalmology. It has evolved from automation of manual tasks such as processing of ophthalmic images to machine learning and deep learning. The machine learning is a subset of artificial intelligence that allows automated system to learn from available data by discovering the best parameters within a general model such as support vector machines or random forest. The deep learning is basically a subset of machine learning that involves deep neural network architecture. The multiple layers of network neuron performs feature extraction. This ability has led to significant breakthrough in performance on various image classification tasks in ophthalmology. The artificial intelligence has brought a breakthrough in many areas of medicine. It has delivered robust results in screening and detection of diabetic retinopathy, ARMD, and ROP. The cataract management is another field that can benefit from greater AI applications. Now, cataract is a leading cause of reversible blindness affecting approximately 12.6 million worldwide. Improved diagnosis, monitoring, and surgical management are necessary to address this challenge. Developing countries often suffer from limited access to tertiary care, a problem further exacerbated by ongoing COVID-19 pandemic. The artificial intelligence can help transform cataract management by improving automation, efficacy, and overcoming geographical barriers. The artificial intelligence can be applied as tele-diagnostic platform to screen and diagnose cataract using slit lamp and fundus photograph, classify referable cataracts by deep learning by convolutional neural networks. The teleophthalmology screening program exploiting artificial-based software could reduce pressure on tertiary referral centers, providing screening evaluation before referring the patient to specialized hospital services. The artificial intelligence algorithm for automatic grading of nuclear cataract differ according to the type of input images used, the slit lamp photographs or the color fundus photographs. Now, the automatic grading of nuclear cataract can be slit lamp based images, and various studies have been conducted by various authors. Like Fan et al. In 2003, he proposed an automatic nuclear cataract classification system based on slit lamp photography. They devised a linear grading function to detect nuclear sclerosis severity based on landmark intensity. Moreover, the machine grading reduced the time necessary for classification to less than 2 seconds versus previous 2 minutes. Now, there are other studies done by, for example, Acharya et al. In 2009, who employed artificial neural network as a classifier to distinguish cataract from normal and post-cataract eye images. And it had 98% sensitivity and 100% specificity. And other studies have been done by Lee et al. In 2010. He applied a modified active shape model, a type of shape detection algorithm, to first identify the location of the crystalline lens and its nucleus on slit lamp photograph, and then to develop an algorithm for nuclear cataract severity grading using a support vector machine, a form of machine learning algorithm model, as has already been told by Dr. Bali. Now, Zhu et al. In 2013 also used the same modified ASM for identification of lens location, but they then applied the bag of features model for feature extraction and group spaciocy regression, a form of machine learning for feature selection and nuclear cataract severity grading. The Gao et al. In 2015 established a different system which is based on convolutional recursive neural network, a form of deep learning for lens structure detection and automatic feature learning. The support vector machine regression was then utilized for cataract severity grading. Kim et al. In 2019 said he rationalized that since cataract grading degrades the performance because these models simplify the opaque pattern of cataract into linear forms, he used the tournament-based CNN to grade the cataract more efficiently, which does not degrade the images. Now, Wu et al. In 2019, he validated a universal artificial intelligence platform for cataract diagnosis and management based on dataset derived from Chinese Medical Alliance for Artificial Intelligence, that is CMAI. Now, he used the images for deep learning for training the mediatic slit lamp, mediatic diffuse, and non-mediatic slit lamp and non-mediatic diffuse. Now, traditional cataract grading system with the deep learning system for cataract management it usually relied on the gold standard, the mediatic slit lamp mode. But in this study, the non-mediatic capture mode, even in the diffuse condition, showed comparable results. So these results suggest that the feasibility of using artificial intelligence agent via a mobile application, even for collection of images from a patient at home. Now, there are automatic grading of the nuclear cataract based on the fundus images, and various studies have been conducted. For example, Dong et al. In 2019, he developed an algorithm of artificial intelligence using combination of machine learning and deep learning algorithm using fundus images. Features in the images were first extracted by deep learning network based on the CAFE software, followed by cataracts detection, non-cataract or cataractus, and severity grading using a softmax function, a form of machine learning algorithm. The Ryan et al. In 2018, he developed an algorithm which used the convoluted neural network to form a deep learning for initial feature extraction, and then he used the random forest network, the machine learning model, for prediction of the cataract presence. Pratap and Kohli in 2019, it was similar to Ryan et al. He applied their artificial intelligence system, a combination of CNN and SVM. He established through labeling of the visibility of fundus images to denote the 4 classes of cataract severity: the non-cataract, the mild, moderate, and the severe cataract. Now, Zhang et al. In 2019, he said, on the contrary, unlike the above mentioned studies, whereby a combination of deep learning and machine learning algorithm were used, he described a deep learning method system that was based only on the deep convoluted neural network only. He did not use machine learning, and this method he called as multi-feature stacking. Now, more the lens opacity, more the fundus image gets blurred, and he divided the cataract into 6 grades. If it was clear and distinguishable, it was labeled as non-cataractous. If the small retinal vessels was visible as slightly mild, if the small retinal vessels were fuzzy, it was labeled as mild, and if the optic disc and large retinal vessels were visible, it was labeled as medium, and if only optic disc was visible, he labeled it as slightly severe, and if the fundus was not visible, as severe. Now, the pediatric cataract screening and diagnosis. Visually significant pediatric cataract should be treated promptly to avoid irreversible myopia. The diagnosis is often delayed for patients who do not have easy access to specialized centers. The artificial intelligence have shown promising results and can help address these issues. The Lin et al. In 2020, he developed a novel artificial intelligence screening model to identify infants with a high risk of developing congenital cataracts. A set of 11 non-imaging risk factors, example, family history and preterm delivery, were analyzed using random forest and adaptive boosting algorithm to identify predictive factors, demonstrated that the potential to serve a complementary screening tool, especially in underdeveloped and remote areas. Now, considering the diagnosis, a highly accurate machine learning platform called CC Cruiser was developed by ZISHAN Ophthalmic Center. The CC Cruiser used a CNN algorithm to grade and diagnose cataract on satellite images. It was capable of diagnosing, grading, and initiating therapeutic decisions to manage pediatric cataract. And the time to diagnose was about 3 times shorter compared with the ophthalmologist's opinion. The enhanced artificial intelligence technology can provide an alternate model of care that reduces the workload and provide time and cost-effective management. Now, ePaharwai is an artificial intelligence-based application in India. It was developed by Tamil Nadu E-Governance Agency. It allows healthcare workers to identify cataracts on spot with 95% accuracy. The application is available on Google Play Store, installed in the healthcare workers' smartphones. The healthcare workers enter the patient detail, click photos of both the eyes, and submit it. The artificial intelligence system will process images and classify it as mature, immature, or no cataract. The ePaharwai application is poised to help 20 million 50-plus aged Tamil Nadu residents susceptible to developing cataract. However, this solution can just as well be implemented across other states, essentially limiting the burden on the healthcare system and reliance on limited number of ophthalmologists. Now, there are other applications of artificial intelligence in cataract. For example, it is used in IL-PAR calculation. Some of the latest IL formulas have used the artificial intelligence to enhance the predictive accuracy. And during intraoperative support, video monitored surgery and intraoperative assistance can be useful. The artificial intelligence deep learning techniques, videos of cataract surgery could be segmented into constituent phases for subsequent automated skill assessment and feedback to optimize the OR scheduling, and for the post-operative complications to predict the progression of the PCO and eventually need for the YAG laser capsulotomy. So the current and the potential artificial intelligence application in different stages of cataract management can be for screening purposes of the primary care, for detection of the cataract, for classification of cataract, for referring the cataract, intraoperatively for predicting complications and optimizing surgical workflow, and post-operatively to predict the PCO progression and requiring YAG capsulotomy. There's certain limiting factor in the artificial intelligence in these programs. The computer-aided cataract diagnosis existing algorithms have not been optimized for the presence of noise in the real fundus retinal pictures, which is a severe concern because even minor noise level might compromise the cataract diagnosis efficiency. Vulnerable to distinct biases with respect to training data that in turn might decrease the efficiency in improving patient outcome in clinical settings. The datasets that are used for the artificial intelligence algorithm generation may contain incomplete clinical metadata. Important that training data reflects the setting in which the artificial intelligence algorithm would be used. This limitation makes it difficult to extrapolate population characteristics to assess the disease spectrum. Now, several artificial intelligence algorithms created and tested using experimental designs and datasets, however, cannot replicate the real-world scenarios, leading to generalizability issues. The machine learning datasets cannot effectively represent the actual human population. Hence, for patients beyond these groups, the results obtained from the application of the artificial intelligence algorithms become less predictable, which may lead to undesirable inferences. The real-world applicability and generalizability of these algorithms might be limited owing to the challenges in the development and validation. Prior to the real-world application, these artificial intelligence algorithms must be evaluated through randomized trials to assess the safety, cost-effectiveness, and efficacy in clinical settings. The recent studies have shown that artificial intelligence algorithms have potential to exhibit comparable or higher accuracy compared to that experienced by the clinicians. The optimization of cataract patients management is crucial now more than ever. The COVID-19 has significantly increased the waiting list to access the cataract surgery. The international guidelines have suggested a reduction in the number of unnecessary visits for the patients. With advances in technology, there has been an emergence of several artificial-based imaging tools and smartphone applications to provide support for clinical decisions. Such applications can help deliver ophthalmology care across triage, diagnosis, and monitoring. Thank you.